All right, guys, it's January 2025. Let's talk about how you're going to handle Medicare deductibles resetting in the new year. Now, if you have a full administrative team or a billing department, if you have people around that can call and verify coverage on the primary and the secondary, make the determination that if there is a Medicare supplemental in place, that supplemental will or will not pick up the deductible, then go ahead and do things the way you normally do things. But this video is really for the very small provider, the single owner operator, the person that doesn't have an administrative team behind them to support them. You are not in the same position. So I'm going to give you two options on how you can handle Medicare deductibles in the beginning of the year. The easiest thing to do, in my opinion, and the most cost-effective thing to do is to assess each patient on a case-by-case basis. If you're treating a Medicare beneficiary, maybe they're continuing care from December of 2024, or they're new to your practice in January, and you're finding that this patient has a lot of other healthcare services that are being provided, you can pretty well assume that patient's Medicare deductible will be satisfied by another healthcare provider within a couple weeks or even a month or two. I would choose to delay submission of those Medicare claims until the deductible has been met by another provider. Let the other provider handle collections in the office, because when you collect at the time of service, you're guaranteed the money, but you're also guaranteed usually to pay credit card processing fees, to have extra administrative burden. You have to figure out a way to get that money into the bank if it's not coming through credit card or direct deposit. So these are added costs to small providers who don't have the extra administrative help to handle it. So what I used to do historically was I would just delay submitting claims for a month or two for these Medicare beneficiaries who are already receiving other healthcare services. I would verify their deductible being satisfied or remaining through the MAC portal. And once it is satisfied, then I would submit claims so that I was paid the full allowed amount through Medicare direct deposit. The other option, if you are treating a Medicare beneficiary who just is in great shape, they're healthy, they're not going to a bunch of other healthcare providers, they're probably not going to satisfy that deductible, I would just go ahead and collect based on the allowed amount. You're going to satisfy the deductible within a couple of visits. And then once the claim is processed, if the supplemental does in fact cover the Medicare deductible, you would issue a refund to that patient. But keep in mind that issuing a refund does include typically refund fees if it was processed through a credit card. And of course, if you're collecting deductibles and the patient is paying with a credit card, you're going to have the credit card 2.5% that you're losing there. We're already operating on razor thin margins. So for my business, it was always easier just to wait a month or two, let the Medicare deductible get satisfied by other providers, and then submit my claims to receive full payment from Medicare and the supplemental. If you're not in a position to interrupt cash flow like that, then go ahead and collect that at the time of service based on the allowed amounts that are published, and then refund anything that you've collected that is in excess of what is actually owed once the EOB is processed.